Joint pain in your 50s is a common issue many people experience as they age, often due to the natural wear and tear on the joints over time. This discomfort can stem from various causes, including osteoarthritis, where the cartilage that cushions the joints deteriorates, leading to pain and stiffness. Other factors might include past injuries, overuse of specific joints, or underlying health conditions, such as rheumatoid arthritis and autoimmune disorder. Joint pain can greatly impact daily life, making routine tasks like walking, climbing stairs, or even getting out of bed difficult and uncomfortable. It can also lead to reduced mobility, which may result in a sedentary lifestyle, potentially causing weight gain and further stress on the joints. To manage joint pain, it's crucial to adopt a lifestyle that includes regular low-impact exercise, a healthy diet rich in anti-inflammatory foods, and maintaining a healthy weight. Additionally, certain oils and herbs are known to help alleviate joint pain by reducing inflammation and promoting joint health. In this video, we'll explore 5 anti-inflammatory oils that can help manage joint pain, followed by 3 of the best herbs that are readily available for this purpose. So be sure to watch until the end, like the video, and don't forget to subscribe to our channel. Let's start with oil number 1. Extra virgin olive oil. Extra virgin olive oil is more than just a kitchen staple. It's a powerful natural remedy for joint pain, especially beneficial for those over 50. Rich in monounsaturated fats, this oil contains potent anti-inflammatory properties, primarily due to a compound called oleocanthal. Oleocanthal functions similarly to non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, by inhibiting the activity of cyclooxygenase COX, enzymes responsible for inflammation and pain. Unlike NSAIDs, extra virgin olive oil offers these benefits without the potential side effects associated with long-term use of such medications. Regular consumption of extra virgin olive oil has been linked to reduced joint pain and stiffness, particularly in conditions like osteoarthritis, which is common as we age. Incorporating this oil into your diet, such as by using it as a salad dressing or drizzling it over vegetables, can provide consistent, mild anti-inflammatory effects that accumulate over time. Beyond dietary use, extra virgin olive oil can also be applied topically. When massaged into the skin, it penetrates the layers to help reduce inflammation and improve circulation, offering immediate relief from pain and stiffness. This dual action, both as a food and a topical treatment, makes extra virgin olive oil a versatile and highly effective option for managing joint pain naturally. Whether you're adding it to your meals or using it as part of a soothing massage routine, extra virgin olive oil can play a crucial role in maintaining joint health and mobility as you age. 2. Eucalyptus oil. Eucalyptus oil is a standout remedy for alleviating joint pain, particularly for those experiencing the aches and discomfort that often come with age. Extracted from the leaves of the eucalyptus tree, this oil is celebrated not only for its refreshing scent, but also for its potent anti-inflammatory and analgesic properties. The primary active ingredient in eucalyptus oil is menthol, known for creating a cooling sensation upon application, which can significantly ease pain and stiffness in sore joints. This cooling effect is particularly beneficial in reducing inflammation, a common cause of joint discomfort, as it helps to numb the affected area, providing both immediate and lasting relief. Eucalyptus oil's anti-inflammatory properties work at a deeper level by reducing swelling around the joints, improving mobility, and decreasing the intensity of pain over time. Beyond its topical applications, eucalyptus oil can also be used aromatically. Adding a few drops to a diffuser can fill your space with its calming aroma, which not only uplifts your mood but also promotes relaxation, further aiding in the management of chronic pain. This dual action, targeting pain both physically and mentally, makes eucalyptus oil an invaluable tool in a holistic approach to managing joint pain, especially for those over 50 who may be seeking natural alternatives to over-the-counter medications. When applying eucalyptus oil topically, it's important to dilute it with a carrier oil like coconut or olive oil to avoid skin irritation. Once diluted, it can be massaged directly into the skin over the painful joints, enhancing blood circulation to the area and delivering relief more effectively. The combination of eucalyptus oil's natural properties and its ease of use makes it a must-have for anyone looking to manage joint pain naturally and effectively. 3. Peppermint oil. Peppermint oil is a potent natural remedy for joint pain, particularly beneficial for those experiencing discomfort as they age. Derived from the leaves of the peppermint plant, this essential oil is rich in menthol, a compound known for its powerful analgesic and anti-inflammatory properties. The cooling sensation provided by menthol can offer immediate relief from the burning and throbbing associated with joint pain. When applied topically, peppermint oil can penetrate the skin, working its way into the underlying tissues to help reduce inflammation and soothe aching joints. Due to its potency, it's important to dilute peppermint oil with a carrier oil, such as coconut or jojoba oil, before applying it to the skin to prevent irritation. A few drops of peppermint oil mixed with carrier oil can be massaged directly onto the painful area, providing almost instant relief from stiffness and discomfort. Additionally, peppermint oil's invigorating aroma has a refreshing effect on the mind, which can help uplift your spirits when dealing with chronic pain. Beyond its topical use, peppermint oil can also be added to a warm bath, where the steam can aid in opening airways while the oil works to relieve muscle tension and joint pain. This dual action makes peppermint oil a versatile and effective option for managing joint pain, especially for those looking for a natural alternative to over-the-counter pain relievers. Moreover, its antispasmodic properties make it an excellent choice for those dealing with muscle cramps or spasms, often associated with joint issues. 4. Ginger oil. Ginger oil is a powerhouse when it comes to natural remedies for joint pain, particularly for those in their 50s and beyond. Extracted from the rhizome of the ginger plant, this oil is renowned for its potent anti-inflammatory and analgesic properties. The active compounds in ginger, such as gingerol, shogaol, and zingerone, work together to reduce inflammation, which is often the root cause of joint pain. These compounds inhibit the production of pro-inflammatory chemicals in the body, such as prostaglandins and leukotrienes, which can cause swelling and discomfort in the joints. In addition to its anti-inflammatory effects, ginger oil also improves circulation, helping to deliver more oxygen and nutrients to the affected areas, thereby promoting healing and reducing stiffness. Using ginger oil for joint pain is not only effective but also versatile. One of the most popular methods is to apply it topically. You can dilute ginger oil with a carrier oil like coconut or olive oil and massage it directly onto the painful joint. This can provide almost immediate relief as the warmth of the ginger oil penetrates deep into the tissues, soothing pain and relaxing the muscles around the joints. Another effective method is to use a warm compress with ginger oil. Simply add a few drops of ginger oil to a warm, damp cloth and apply it to the affected area. The combination of heat and the therapeutic properties of ginger oil can significantly reduce pain and improve mobility. In addition to topical application, ginger oil can also be used in aromatherapy. Inhaling the invigorating aroma of ginger oil can help reduce the perception of pain and promote a sense of well-being, making it a great option for those who suffer from chronic joint pain. Some people also add ginger oil to their bath water for a full body soak that can ease multiple joint pains at once. This method allows the oil to penetrate the skin and work on a larger area, providing widespread relief. What makes ginger oil particularly appealing is its long history of use in traditional medicine, where it has been trusted for centuries to treat various ailments, including joint pain. Modern scientific research continues to support its effectiveness, making it a safe and natural alternative to over-the-counter pain medications. However, it's important to note that while ginger oil is generally safe for most people, it should always be used with caution, especially if you have sensitive skin or are pregnant. 5. Frankincense oil. Frankincense oil, often referred to as the king of oils, has been revered for thousands of years for its healing properties and is particularly effective in alleviating joint pain. Derived from the resin of the boswellia tree, this essential oil contains powerful anti-inflammatory compounds, such as boswellic acids, which have been shown to inhibit the production of inflammatory molecules in the body. This makes frankincense oil especially beneficial for those suffering from conditions like arthritis, where inflammation is a key contributor to pain and stiffness. Frankincense oil not only reduces inflammation but also promotes better circulation, which is crucial for joint health. Improved circulation helps to deliver essential nutrients and oxygen to the affected joints, facilitating faster healing and reducing pain. Additionally, frankincense oil is known for its ability to support the regeneration of damaged tissues and the maintenance of healthy cartilage, both of which are essential for joint function. Its analgesic properties provide a soothing effect, making it an excellent choice for those who experience chronic joint pain. The versatility of frankincense oil allows it to be used in various ways to address joint pain. You can dilute it with a carrier oil and massage it directly onto the affected areas, helping to alleviate discomfort and stiffness through both the oil's properties and the massage itself. Alternatively, adding a few drops to a warm bath can provide full-body relief as the oil penetrates the skin and reaches deep into the tissues. The calming aroma of frankincense also promotes relaxation, which can be particularly beneficial for those whose joint pain is exacerbated by stress. Moreover, its potential to boost the immune system further supports its role in managing conditions like rheumatoid arthritis, where the immune system mistakenly attacks the joints. While frankincense oil is generally safe for most people, it's always a good idea to perform a patch test before using it extensively, especially for those with sensitive skin. Beyond oils, there are several herbs that have been used for centuries to alleviate joint pain and promote joint health. Let's take a look at 3 of the best herbs you can find on the market. 1. Turmeric. Turmeric is a powerful herb that has been used for centuries in traditional medicine, particularly in Ayurvedic practices, to treat various ailments, including joint pain. The active compound in turmeric, curcumin, is known for its potent anti-inflammatory and antioxidant properties. Curcumin works by inhibiting the production of inflammatory cytokines and enzymes in the body, such as cyclooxygenase 2 (COX-2), which play a significant role in causing pain and swelling in the joints. This makes turmeric especially beneficial for those suffering from osteoarthritis and rheumatoid arthritis. One of the key advantages of turmeric is its ability to not only reduce inflammation, but also to protect the joints from further damage by neutralizing free radicals, which can cause oxidative stress and contribute to joint degeneration. Incorporating turmeric into your diet, either as a spice or in the form of supplements, can help manage chronic joint pain effectively. Turmeric can be added to curries, soups, and smoothies, or taken as a supplement in capsule form. However, it's important to note that curcumin is not easily absorbed by the body, so it's often recommended to take it with black pepper, which contains piperine, a compound that enhances curcumin absorption. In addition to its anti-inflammatory benefits, turmeric also promotes overall joint health by supporting the maintenance of cartilage, the tissue that cushions the joints. This can be particularly beneficial for those in their 50s and beyond, as cartilage tends to wear down with age, leading to increased joint pain and stiffness. While turmeric is generally safe for most people, it should be used with caution if you are taking blood-thinning medications or have certain medical conditions, as it can interact with these treatments. Consulting with a healthcare professional before starting a turmeric regimen is advisable, especially if you are on medication. 2. Boswellia. Boswellia, also known as Indian frankincense, is a highly regarded herb in traditional medicine for its ability to alleviate joint pain and improve joint health. Extracted from the resin of the Boswellia tree, this herb is particularly effective due to its strong anti-inflammatory properties. The active compounds in Boswellia, known as boswellic acids, have been shown to inhibit the production of inflammatory molecules, such as leukotrienes, that contribute to chronic inflammation and pain in the joints. This makes Boswellia an excellent choice for those suffering from arthritis, particularly rheumatoid arthritis and osteoarthritis. One of the unique benefits of Boswellia is its ability to improve joint flexibility and reduce stiffness, which is often a significant issue for those dealing with chronic joint conditions. Regular use of Boswellia supplements can lead to a noticeable reduction in joint pain, swelling, and discomfort, allowing for improved mobility and a better quality of life. Additionally, Boswellia has been shown to support the regeneration of cartilage and protect against further joint damage, making it a valuable herb for long-term joint health. Boswellia is available in various forms, including capsules, tablets, and topical creams. When taken as a supplement, it's important to follow the recommended dosage on the product label or consult with a healthcare provider to ensure safe and effective use. Some people also use Boswellia topically by applying it to the affected joints, which can provide localized relief from pain and inflammation. As with any supplement, it's essential to choose high-quality Boswellia products to ensure that you are getting an effective dose of the active compounds. While Boswellia is generally safe for most people, it can cause mild gastrointestinal side effects in some individuals, such as nausea, acid reflux, or diarrhea. These side effects are typically mild and can often be minimized by taking the supplement with food. If you have any underlying health conditions or are taking other medications, it's a good idea to consult with a healthcare professional before starting Boswellia, as it can interact with certain drugs. 3. Devil's Claw. Devil's Claw is a potent herb native to southern Africa, traditionally used to treat pain and inflammation, particularly in the joints. The herb gets its name from the peculiar appearance of its fruit, which is covered with hook-like structures. However, it's the roots of the plant that are most commonly used for medicinal purposes. Devil's Claw contains active compounds known as iridoid glycosides, primarily harpacoside, which have been shown to possess strong anti-inflammatory and analgesic properties. These compounds work by inhibiting the production of pro-inflammatory chemicals in the body, helping to reduce pain, swelling, and stiffness in the joints. Devil's Claw is particularly effective for conditions such as osteoarthritis and rheumatoid arthritis, where chronic inflammation leads to persistent joint pain. Studies have shown that regular use of Devil's Claw can lead to significant improvements in pain levels and joint function, allowing for better mobility and a higher quality of life. In addition to its anti-inflammatory effects, Devil's Claw also acts as a natural pain reliever, making it a valuable herb for managing both acute and chronic joint pain. Devil's Claw is available in various forms, including capsules, tablets, tinctures, and topical creams. When taking Devil's Claw as a supplement, it's important to follow the recommended dosage on the product label or consult with a healthcare provider to ensure proper use. Topical applications can also be effective for localized pain relief, particularly when combined with other anti-inflammatory oils like eucalyptus or peppermint oil. While Devil's Claw is generally safe for most people, it can cause mild gastrointestinal side effects in some individuals, such as stomach upset, diarrhea, or nausea. These side effects are usually mild and can often be minimized by taking the supplement with food. However, if you have underlying health conditions, such as peptic ulcers or cardiovascular issues, it's important to consult with a healthcare professional before using Devil's Claw, as it can interact with certain medications and may not be suitable for everyone. In conclusion, joint pain can be a challenging issue, especially as we age, but incorporating these oils and herbs into your daily routine can provide significant relief and improve your overall joint health. Remember to consult with a healthcare professional before starting any new supplement, especially if you have underlying health conditions or are taking other medications. Thank you for watching, and don't forget to like, subscribe, and hit the notification bell for more videos on natural remedies and health tips.